it's time for another Medicine Monday, where the aim is to educate, empower and equip you with the knowledge that you need to live your healthiest life. So today we're going to be talking all about erectile dysfunction. So, erectile dysfunction. Sometimes just those two words may have you feeling quite anxious and uncomfortable, and so let's call it ED for the rest of this video, something a bit more palatable, and hopefully doesn't make some of you men feel too uncomfortable with me talking about it. But we really do need to talk about ED. So what is ED? The definition for it is the inability to have or to keep an erection long enough to have sexual intercourse. So ED is a difficult topic for some people to speak about. It is a really intimate thing. We're talking about the bedroom, we're talking about sex. And so this isn't something that you want to share with the whole world, but it is something that I as a doctor see quite regularly and really needs to be addressed and needs to be spoken about. ED is actually very common. In men over the age of 40, about half of them will suffer from ED. And sometimes the cause is difficult to know because it can often be multifactorial. So it can be lots of different things that are playing a role in this. But it is common. But the thing to say is that although it is common and with advancing age it can become more likely to happen, it doesn't mean it's normal. When I think about ED, I like to look at it more as a symptom or a sign of another problem rather than it being a disease in itself. The reason I say that is because ED, we can treat it just in isolation. So you can come to your doctor and say that I'm having trouble getting an erection, I think I've got ED, and you'll have a little chat about it, and we could simply just give you a tablet so that you can have an erection and leave it at that. But we really need to look into things more, because for me, when I hear ED, it just sets off warning signs that there's an underlying problem and an underlying diagnosis that needs to be found. Now, I did say that it increases with advancing age, but actually, as time is going on, it's becoming more and more common to see ED in people who are younger, in their 20s and their 30s. And there are a variety of reasons for this. And that's where I want to start really with what are some of the causes of ED. Now, in a lot of the younger people who are suffering from ED, and it does affect the older ones as well, it's often a psychological cause for why somebody's struggling so much. It may be that the person suffers from a lot of stress, anxiety or depression, and that can often go into problems with performance anxiety. If the person is in a relationship that is quite tense or isn't a happy relationship, often ED can start to creep in and cause problems. This doesn't always mean there's a physical cause, and often the way in which to treat it is to treat the underlying stress, anxiety, depression or relationship problems, and things will improve. Some signs that will tell you that this is more of a psychological cause than it being anything else is if you're still getting morning erections, or if you're still able to have an erection to masturbate, but you find that it's just a problem when you're actually having sexual intercourse with a partner. Now, with the psychological aspect of ED, it can often become this cycle where it may start off that it is about anxiety or depression or not feeling very comfortable in the relationship, and that leads to ED. But once you've had one episode of ED, you start to become a bit worried, and so the next time you go to have sex, you start having that performance anxiety or that stage fright, and that then produces more anxiety or more stress. But then you don't have another erection, and the anxiety increases, and then you don't have another erection, and then the anxiety increases, and so on and so forth. And so often we go into this cycle of things, and that's why we have to kind of put it where we are and say, let's actually treat this anxiety and depression and try and get things back. Now, the mental health effects of ED isn't just associated with the man, but often with the man it can be linked with self-worth. And a lot of men who suffer from ED can start to have low self-esteem and reduction in their confidence. But not only does it affect them, it also affects the person in relationship with them. Of course, the person that they're having sex with. In women in particular, having a partner who suffers from ED, especially when it's not communicated and spoken about, can lead to body image difficulties with the woman, and them feeling low or stressed or anxious about things too. So really it does need to be addressed because it starts to affect the whole relationship. Other causes of ED can be a bit more simple to find. Say if it was caused by an operation or by some treatment. For example, those who are treated with radiotherapy or chemotherapy during cancer, or for those people that have had a surgery in the pelvis kind of region, they can often go on to develop ED. And in those cases, a bit more might need to be done in terms of treating it rather than just giving a simple pill. Other causes may also be drugs. There are some notorious causes for ED, and those are blood pressure medication and medication to treat depression. Now really you have to weigh the risks and the benefits of treating the blood pressure and the depression with having ED. And for a lot of people, it won't be sensible to stop those treatments because their mental health will suffer or their overall health if their blood pressure starts to creep up without the medication. And that is where more tablets or more treatment is needed for the ED. But sometimes those previous tablets can be stopped or reduced, and we can see if those things will help. Now if we think about how an erection is actually caused or how it develops, that can often give us information and help us to understand some of the causes of ED. Now, what happens in an erection there's three processes really. So step one in an erection is the sexual stimulation that happens in the brain. Your brain will become aroused and that will send signals to your penis to have an erection. And that message is sent through the nerves. Now, once that message has reached there, the blood flow will then increase to the penis, which causes an erection. And then to keep the penis erect, the muscles that sit around in the pelvic floor will strengthen and contract and keep the erection there. So as you can see, there's three parts. There's the nerves, there's the blood vessels, or the blood flow, and then there's the muscles that are there. Now, if there's a problem with the nerves, it may be because there's been a spinal cord injury. Someone may have been in an accident, had a fall, and done something to their spinal cord, which has caused that signal from the brain to then be disconnected from the penis. Another cause of nerve problems may be diabetes. Another way in which the nerves can be affected is by diabetes. Now, we know that diabetes affects the nerves, and often we find it first in the feet, but it can also cause ED. Also, diabetes affects the blood vessels around the body, and so that can impact ED too. And that's why poorly controlled diabetes, those patients with that condition can often go on to develop ED. Also, raised blood pressure, having a high blood pressure can cause ED, as it often damages the vessel. Now, like I said before, ED to me usually is a bit of a red flag, a warning that something else is going on. And if there are some vessel disease that's causing ED, there may be vessel disease elsewhere in the body. And it isn't uncommon to find that somebody with ED, when we investigate them a bit further, we might even find that they have heart disease as well. Now, one more cause of ED that I do think it is important that we address is something called porn-induced ED. Now, this is becoming more and more common as time goes by. And the reason for that is because porn is really easy to access. Before, I think maybe 20 years ago, to get porn you had to go into one of those adult film shops or go into the back of a video shop or something, and that is where you would access porn. Now with the advent of internet and as it's getting more and more prevalent, it's very easy to access porn. You can just go onto your phone and within minutes, well even within seconds actually, you can be watching some kind of porn video. Now the reason why this can cause ED is because in porn, the sexual activities that happen there are often very hypersexualized and often very stimulating. And that means that men that watch a lot of porn can often start to rely on that hypersexualization and that overstimulation to become aroused. And when they have more intimate or in reality sexual experiences, they're not getting that same heightened arousal that they're used to, and so they're not being aroused enough and they're suffering from ED. Now the way in which we treat this porn-induced ED is actually to stop watching porn. Stop it altogether. And what this does is that it helps the brain to start to reset over time and not be so dependent on those hypersexualized experiences. So now, after looking at so many different causes of ED, often it's very difficult for us as doctors to say this is the exact cause, and that's because it's usually multifactorial. A lot of these different things that I've spoke about all playing a part in it. And so the way in which we treat ED really has to be holistic and look at all these different factors that may be having some kind of impact. I start noticing a theme with my videos that the treatment for a lot of these different diseases that a lot of people suffer from are usually quite common. And that's because most of the diseases that we have are usually lifestyle related or behaviour related, and so the treatment is often very similar. Now with ED, it's no different to treating or trying to reduce your risk of having a heart attack or a stroke, or trying to reduce your risk of having diabetes. So the first thing, to try and prevent ED or to try and treat it, the first thing is to stay physically active, to try and get your body moving. The second is having a healthy diet, and the third is trying to keep a healthy weight. If you're obese or overweight, that often will have an impact on ED, and so try to reduce that weight down to being more within the healthy limits. Also, in addition to that, there's been a strong link between alcohol and smoking and ED. Those of you that drink a lot of alcohol quite frequently, it would be a very good idea to cut that down if you are suffering from ED. And if you drink alcohol before having any kind of sexual experience, then it might be worth stopping drinking alcohol before these sexual experiences, even if you feel like it relaxes you, because often that can contribute to ED. And smoking, we're in 2021 now. So many reasons are out there for stopping smoking. The number of campaigns, I can't even count them. But this is another reason to kickstart you into quitting smoking if you haven't thought about it already. And that is, there's a very strong link between smoking and ED because of the way in which smoking and the chemicals that are in cigarettes affect the vessels that supply the penis. Other ways in which you can treat ED, we spoke about having therapy or seeing a counsellor or talking about things with your relationship and being open with your partner for that psychological aspect of ED. But also seeing a physical therapist can often help, or even doing the exercises yourself. Earlier I spoke about the 3 stages of achieving an erection: the nerves, the vessels and the muscles, but I didn't really touch on the muscles too much more. Now, your pelvic muscles are the ones that are involved in having an erection. Those are the muscles that surround the base of the penis and also go around to your back passage as well. Now, those muscles, when they're contracted, they help to maintain the erection for a longer period of time, so that sexual intercourse can happen. The way in which we can strengthen those muscles are something called pelvic floor exercises. You may have heard of them being spoken about quite frequently for women, but also they do help men as well. And there are lots of videos that I've seen on YouTube and lots of Google searches you can do to get some more information. They may also be known as Kegels, and so doing those regularly can really help with keeping an erection for longer. If you're struggling to do those exercises by yourself, in some regions there are physiotherapists that specialise in pelvic floor exercises, and ask your GP, they may be able to refer you. And so what happens if you've done all those things to try and treat your ED but things still aren't working? Well, what we can do is actually give you some medication, a small blue pill that a lot of you might have heard of called Viagra. Now, usually I don't really refer to it as Viagra, that's the brand name, but the generic name that a lot of us talk about is something called sildenafil. And sildenafil is just one in a family of drugs that can be used to treat ED. Now, it is a small pill that is taken about an hour to half an hour before having any kind of sexual activity. For some people, 1 tablet works, but some they may need to have a higher dose, and sometimes the first tablet that's tried doesn't work and a different one from that family of drugs is needed. For the majority of men, sildenafil is quite safe and can be used, but there is a small percentage of people that it isn't safe to use it in, and that's often with people with certain heart conditions, which your doctor will be able to advise you on. If you're in that group of people who it isn't safe or suitable to use that medication, or you're someone that's tried different drugs from that family of medication and still you're not having any hope with your ED, all hope is not lost. There is still more that can be done, and at that point, your GP will refer you on to the urologist to have some further treatments down the line. So that in a nutshell is ED. That's mostly what I wanted to say about it, but I think it is always good to try and give you a bit of an idea of what happens when you come to the GP to discuss something as personal as ED. As with all GP appointments, we start off by just sitting down and having a chat. We might talk about some very personal things because, like we said, the ED is all about what's happening in the bedroom, which is a personal and intimate area. So please come in open to have a discussion. The more you tell us about your porn use, your relationships, and whether you're getting morning erections, will all help us to make the best management plan for you. In addition to the history, an examination will usually happen. We'll check your blood pressure, we'll have a listen to your heart, and usually check your weight as well. Depending on what you say in the history, it may be appropriate for us to also have a look at the genitals or to check the prostate. These are quite intimate examinations and sometimes you might not feel comfortable. Please feel free to let your GP know. We can always schedule another appointment for you at a time when you feel more prepared, or we can get a chaperone to come in to help you to feel more comfortable. Now, once those things have been done, your GP may decide to straight away give you a tablet, and that's not incorrect, but they also are more than likely wanting to do some blood tests as well. Blood tests to look at your overall health, to check you for diabetes, check your cholesterol levels, and also to check your testosterone levels, which is the male sex hormone, which has a big part in having an erection. As you get older, it is common for your testosterone to decrease, and so it's good to know what your current state and current levels are. Once all that's been done and you've gone home with this tablet, if it's appropriate for you, usually in the first instance you're just given a very short course, maybe 4 or 5 tablets to see how that helps, and then you'll have a follow-up with your GP to see what we would do going forward. If that's a higher dose, or if it works well for you, giving you more tablets so that it will last you the month. It all depends on how sexually active you are. If you're having sex once a week, you may only need 4 or 5 tablets. But if you're having sex every day, every other day, you may want more like 20 tablets. It really depends on your risks and your personal needs. I really hope this video has helped you and has been informative. It's a topic that we don't often like to talk about, but it is really, really important. Please don't ignore it. And I really hope you've got the confidence now to talk to your partners and to actually make an appointment to see your GP. If you've liked this, please subscribe to this channel. Please like and share it with your family and friends. There'll be more videos like this coming every Monday, and I really want to have some topics that you've chosen or some things that, burning questions that you have. So please comment down below if you've got any input, and I'll see you next time.